Hello everyone, I'm Leslie Cornwell, Certified Nurse Midwife with Midwifery Business Consultation. This section has to do with tips for hiring a great medical director. A legal disclaimer we put at the beginning of all of our presentations. This information is for general and educational use only, not intended to substitute for professional, legal, or clinical advice. We strive to keep our information as accurate and timely as possible, but make no promises and guarantees it'll work for your local unique situation. Course objectives. The students will be able to verbalize exactly what is a medical director. The students will be able to verbalize the typical roles and responsibilities included in this position. The students will be able to verbalize the tips for making a job description for their medical director. The students will be able to verbalize how to find a great medical director in your community, within your state, or across the country. We'll be able to verbalize the various financial relationships the birth centers can have with the medical director. So why is this a really important topic? If you're running a home birth practice, a women's health clinic, it's not such a big deal, but as a birth center, especially, most of the states have state regulations. If you want insurance reimbursement, getting CABC, the Commission of Accreditation Birth Centers, the requirements you need to have a medical director. So you need to have a pediatrician, an obstetrician, a physician that fills that role. Some states require you directly to have an obstetrician, but it's a very essential thing for someone wanting to start a birth center within their community. It's something that's a big barrier to the success of birth centers opening, maintaining. It's one of the big reasons that birth centers close abruptly overnight. Their medical director retires, the contract terminates, they have a medical issue, medical car accident, and they can't fill that role anymore, and they don't have a backup plan, and there's no one else in the community that wants to fill that role. So it's really, really important to have a strong medical director, having backup plans, having clear expectations of what that director role will look like so that your medical director will stay around and support the birth center long term. So let's go to the basics. What exactly is a medical director? It's a physician that oversees the operations of the birth center. It's required by CABC to get accredited and many state regulations. So if you're in one of the 8 states that doesn't have birth center regulations and you choose not to get nationally accredited, you don't have to worry about the medical director role. But if in time they get state regulations, you want to accept insurance, you want to have a national certifying body to show the high caliber care you're providing, in time you will want to consider a medical director. There's various responsibilities and roles that the medical director can do for you. There's some things required by the state and by the accreditation process that they have to do, and then there's some things you can choose you want them to do, and we'll go in more details on that. So some of the high-level responsibilities can include quality measures, reviewing policies, financial stability if they're part of the financial aspect, especially if they're a business partner within the birth center, providing direct clinical care if you want them to be more of a collaborating physician relationship in addition to being the medical director. We'll talk about the difference between a collaborating physician and a medical director because they are different. When you're recruiting a medical director, it's very clear expectations of the job description and role and responsibility you want them to have, because you recruit a physician, they're not going to know a birth center, most likely the medical director role, the collaborating physician. You have to be the advocate and educate what are each of these roles, what are the responsibilities, and what are you looking for your birth center. So these are definitely important things. Most, I would say, medical directors across the country are more administration responsibilities. They tend to keep to the core job description that CABC has for them and the state regulations responsibilities. So reviewing policies, chart audits, attending administration, quality meetings for clinical care with the birth center tends to be the most common role and responsibility the medical director plays. So these are some of the other things I want you to challenge you, because a medical director can just be that, but they can be many other things for your facility. So I want people to think outside the box, create a win-win situation with a community-based physician. Maybe there is a physician within the state and they could do telemedicine, they could do administration meetings by Zoom. Maybe you pay to fly them into town. Like, I want to challenge everyone. Don't just think about the local doctors in your area. You can get a medical director from anywhere in the country. You can decide to have them be part of the medical team and give clinical care, come into town. This could be a satellite office for higher risk patients with a birth center that they come to see once a month. They could strictly just be administration, get a state license, do telemedicine, do just administration responsibilities. There's a lot of different ways you can creatively get a medical director for your team. These are some other additional things for roles and responsibilities to think about. The medical director can help you with recruiting and collaboration improvements with the community physicians, the pediatricians, the obstetricians, the maternal fetal medicine, primary care providers, paramedics, for transfers and transports and protocols, hospitals, nursing staff, labor and delivery, administration, OB department. There's so many layers of what having a medical director can help and improve with the physician midwife collaboration for the birth center. They can help with examining the activities of the quality care measures, the day-to-day operations, how are patients' intakes flows going, how often are they seen throughout the pregnancy, what are the educational topics, what do the consents look like, how do we collaborate, what's independently cared for by the midwives, what's co-management, what risk out, do we have hospital privileges for the midwife, will the medical director be that collaborating physician or strictly just the medical director for privileges. There's so many things to just think about in that continuity of care and that quality improvement measures. They can assist with the training, the continuing education, promotion of the birth center staff. They can directly be part of the trainings, the certifications. They can just be in the backdrops, reviewing the PowerPoints, the training drills that are going to be done with the team. You can have whatever level of involvement you want the medical director and what they want to be. They can be a key leader with networking with affiliated programs in the area. Maybe there's programs for substance abuse, postpartum mental health disorders, for family resources, low-income families, nutritional support. Some of these things midwives can do, and some of the things the medical director can do. It just depends on if you want them full-time on your team, you want them part-time, you want them just per diem for meetings and the bare minimum of what CAB in the state requires. You really just have to think, what are your budgets? What do you want out of the medical director? And I'm just challenging you with different possible roles and responsibilities the medical director can provide for your birth center. They can do updating, amending policies for the midwifery team, working closely with them, working with the staff, working with the hospitals for transports. This is core requirements of the medical director with CABC and most state regulations. They tend to be quality measures, reviewing near misses and incidental reports, education. They want to help to make sure that there's a core scope of practice with the midwives, and we're working really well with the community to help with those collaboration, those transfer relationships to improve the outcomes. There's other things they can do. They could be that collaborating physician. You could have them do telemedicine. You could have them be on site at a regular rotation. It just depends if they want to be the medical director and the collaborating physician, because they are two very different roles and responsibilities. They may or may not be part of the compliance component, because the birth center can't be around if they're not following state and federal guidelines with insurance, with compliance, with the building, with codes. So the medical director tends to be just reviewing that with the clinical director. Whoever on the team has that responsibility to keep up with the human resource aspect, the team's certifications, their licensures, credentialing, all those things. They're more high level, just keeping an eye with if it's a nonprofit, the board of directors, the owners, if they're the business partners, they're definitely part of that responsibility. Chart reviews for incidental cases, near misses. You can have very specific reports within your EHR system they can review with you. You can have a very specific quality measure auditing system that your nursing staff could have part of their job description, and then part of those monthly, quarterly meetings, you review those near misses, you review those higher risk patients that are needing collaboration with a physician to make sure there's nothing being missed, just to help with a team-based approach to care. So there's different ways to recruit and hire a physician to be your medical director. I think it gets very overwhelming to midwives if they want to open a birth center. They feel so discouraged, maybe their past experiences. Collaborating relationships with physicians are harder to get. If you don't have the strong skills for negotiation, creating value, making a win-win situation, showing the benefits, it is harder for midwives in general just to get a collaborating physician, particularly a medical director for their birth center long term. So I really challenge midwives to think outside the box. There are no hard rules of how this arrangement is set up, except for the anti-stark kickback rules, which we'll talk about in a little more detail. But you could have them on full-time, you could have them on part-time, they could be an employee, they could be an independent contractor, you can offer them benefits, you can not give them benefits. There's a lot of malpractice insurance plans that'll give you insurance coverage for them strictly being the director role, because it is just administration. They're not touching patients, there's no clinical care, so then they can get that peace of mind that they're being protected. Because a lot of times you're going to be choosing and requesting private practice physicians to be your medical director. Most hospitals with non-compete clauses do not allow their employed staffed physicians to be that medical director for your birth center. So you have a little more independence and autonomy with a private practice physician because they run their own practice. They already know what benefits they get there, and you want to create value to them. When you're negotiating, it's not always about money, because if you try to compete with offering them $200-300 an hour that they get for surgeries and they get for their own time with their practice, you're not going to have a very good headway. But you can get creative of like the referrals, like, hey, I can send you all of my patients, so then they get a massive increase. You could show them the data. You could say, okay, we're opening, we're going to have X amount of clients each month. I anticipate 20% are going to risk out. If we send them to your practice, this is an X amount average revenue that's going to come your way. Plus, I would give you a hourly compensation for if we need you for meetings, we need you for policy reviews. It's an average of 4 to 6 hours a month responsibility. Are you open? Are you interested? We would make the meetings around your time schedule. You could do it telemedicine. You can come on site. If they're out of state, you can pay for them to travel into town. If they're doing it as a satellite office and their other office is more than an hour away, you could, especially in a birth center, we have the midwife call room. You could really get creative of like, hey, you can stay in town for a few days, see our patients in the area, and add to your practice a satellite office if you want to do collaborating physician relationship, or if you strictly want to do administration, you can hire a medical director that already has a state license. So anyone in the state or across the country, you just have to get them a license to practice and to be that medical director role in your state. So you can make them virtual, completely virtual if you wanted to. There's no rules and regulations that they have to be on site, but there are core measures and basic things the medical director has to do for you. They have to attend meetings monthly, quarterly, biannually, annually. There's no hard rules of the timelines, but they're reviewing quality charts, policies, discussing the co-management and improving the outcomes of things within the practice so that it stays open and it has great outcomes. You can offer them salary, you can offer them hourly, you can do independent contract. You can't do a referral bonus. You can send clients their way to their practice, but they don't get any compensation for the referral. They just get for whatever care they provide. So if they need a C-section, they want a tubal ligation, they had some gynecological issues and need an endometrial biopsy, their pap was abnormal, they need a colposcopy, they're going to get paid for whatever medical services. You're not going to want to set up a contract that every time you refer somebody there, they get $20, $50, $100, because you're violating the anti-start kickback, because then they start thinking, well, you're just sending them there so that they can make extra money. So you want to make sure your agreements are very clear of that relationship and they're totally separate practices, and you would be sending this person out because they are outside of the scope for a midwife or need some collaboration to any physician, and this is the physician I'm sending them to. So you definitely can get creative with your financial relationships, your roles, your job descriptions, and responsibilities for the medical director. So just as an overall conclusion, I want to stress medical directors are essential for most birth centers across the country. I think as we get more and more regulations in each of the states and we get more requirements of following national guidelines, birth centers are going to need medical directors, and this is a role that's very valuable to the success, the quality measures, that continuity of care, the networking, the collaboration with the community to be a long-standing successful birth center. It's a very important role. There's key things to think about when you're recruiting your medical director. You can get someone local in your community. I lean towards private practices because most employed physicians can't, with their hospital non-compete clauses, even do this role for you as a little side hustle. What pay structure you want to give them. They get a base salary, a retention bonus, kind of like a lawyer every month, and then we want them to do X amount of hours. They're going to do collaboration. They're going to be part-time. I mean, most of the time, because the medical directors are so busy with their private practices, you want to make it the bare minimum requirements for the job description most times. But I've seen really cool business birth center franchises where they're starting out with 3 to 5. They can financially support a full-time director that's also their collaborating physician and goes to all these different locations. But the average midwife, with the financial constraints of a medical director and the size of their birth center, it tends to be a per diem 4 to 6 hour responsibility a month. But there are ways to make it part-time. There are ways to make it very financially successful where they're part of the staff and do collaborating care on top of the medical director role. So always have a backup plan of, if that medical director can't do it, who can you talk to, who can you coordinate with, who can you have a backup plan to fill in if they're on vacation, if they no longer can fulfill that responsibility. I see too many birth centers across the country close overnight because the contract got terminated and they didn't have a backup plan. The medical director retired and nobody else wanted to fill it. They got in a car accident and they just can't do it. So it puts birth centers in very vulnerable positions with risk management to have backup plans. If that person can't do that responsibility for one reason or another, who are you going to find to do it instead?